Disclaimer: I do not own the rights to the material or images. This was purely made for the purpose of studying for boards. The prosencephalon consists of the telencephalon and the diencephalon. The diencephalon is composed of the thalamus, hypothalamus, metathalamus, subthalamus, and hypothalamus, with the third ventricle in the center. The telencephalon is the cerebrum, which consists of two cerebral hemispheres. The cell bodies of the neurons in the cerebrum are located in two general areas. One area is on the external surface of the gyri and the laminations of the cerebral cortex. The other area is deep to the surface in basal nuclei. The caudate nucleus, pallidum, and putamen are basal nuclei that function in the extrapyramidal system. The amygdaloid body and septal nuclei function mainly in the limbic system. The cerebral cortex covers the external surface of the cerebrum and may be divided into three general regions on the basis of the evolution of each. 1. The paleopallium, Paul lobe, consists of the olfactory bulb, the olfactory peduncle, and the cortex of the piriform lobe. 2. The archipallium is the hippocampus, which is an internal gyrus that is rolled into the lateral ventricle during development. 3. The neopallium is the most recently evolved and makes up the remainder of the cerebrum, which includes all the gyri dorsal to the rhinal sulcus. Another grouping of brain components is called the rhinencephalon, the smell brain. It consists of an olfactory component, the paleopallium, see chapter 16, and a non-olfactory component, which is referred to as the limbic system. In the telencephalon, this includes the archipallium. The term limbic system refers to the anatomic arrangement of the telencephalic neurons and tracts that are components of this system and are arranged primarily as two incomplete ring-like structures on the medial aspect of the cerebral hemisphere at its border with the diencephalon, figure 17-1. Limbus means edge or border, and these telencephalic structures form the border of the main mass of the cerebral hemisphere. The term has been expanded in usage to include the major nuclei and pathways in the rostral brainstem that are connected with these telencephalic structures anatomically and functionally. Box 17-1. Anatomy telencephalon. The telencephalic components of the limbic system form two cortical rings at the border of the diencephalic-telencephalic junction. See figure 17-1. The inner ring consists of the amygdaloid body, the hippocampus, and its fornix. The outer ring consists of the cingulate gyrus and its cingulum in the septal area rostrally. The amygdaloid body, one of the basal nuclei of the telencephalon, is a complex of nuclei located in the piriform lobe deep to the olfactory cortex. See figure 17-2 and plates 5 and 6 in chapter 2. A projection pathway of the neurons in the amygdaloid nuclei. The stria terminalis courses in the angle between the thalamus and the caudate nucleus. It forms an incomplete circle shaped like a C that progresses from the amygdaloid body in a caudal, dorsal, and then rostral and ventral direction to terminate in the septal area in the rostral hypothalamus. A diagonal band courses on the ventral surface of the cerebrum, connecting the amygdaloid body with the septal area. The hippocampus is a unique gyrus of the cerebrum, which, in lower mammals, is found on the external surface of the cerebrum, but in higher mammals, it has been rolled into the lateral ventricle and is not visible on the external surface. The hippocampus is shaped like a C. The hippocampus extends in a curve, starting from the amygdaloid body ventrally in each piriform lobe and progressing caudally, dorsally, and then rostrally over the diencephalon. It forms part of the medial and dorsal wall of the lateral ventricle ventrally, and part of the medial and ventral wall of the lateral ventricle dorsally. See figures 17-2, 2-12b, and 12-18b, and plates 5-8 in chapter 2. It lies adjacent to the lateral geniculate nucleus from which it is separated by meninges with cerebrospinal fluid, dorsal to the caudal thalamus. The hippocampus of each cerebral hemisphere meets at the median plane, and a commissure is formed here. The hippocampal commissure, on the ventral surface of the brain, caudal to the piriform lobe. The hippocampus is covered superficially by the parahippocampal gyrus, which is bounded laterally by the caudal lateral rhinal sulcus and medially, where it joins the hippocampus at the hippocampal sulcus. See plates 6 and 7 in chapter 2. The parahippocampal gyrus is continued dorsally, dorsal to the corpus callosum, by the cingulate gyrus. See transverse section in MR image plates 5-8 in chapter 2. Axons course to and from the hippocampus along its lateral side, forming the fimbria and the crus of the fornix. The two crura meet rostral to the hippocampal commissure and continue rostrally as the body of the fornix. See plates 5 and 6 in chapter 2. After coursing rostrally a short distance, just dorsal to the rostral commissure, the body of the fornix bends ventrally. Two distinct cylindric columns of the fornix emerge from the body on each side. Each column of the fornix splits at the rostral commissure. On each side, a small bundle of axons courses rostrally into the septal area, and a larger portion of the column courses caudal to the rostral commissure and ventrally through the hypothalamus beside the third ventricle to terminate in the mammillary body. See plates 4 and 5 in chapter 2. The body of the fornix and the proximal portion of each column are attached dorsally to the corpus callosum by the septum pellucidum. The caudal portion of this septum is not visible unless the lateral ventricle is enlarged and the septum appears as a thin sheet between the body of the fornix and the corpus callosum. Rostrally, this septum contains neuronal cell bodies of the septal nucleus. The leptomeninges extend rostrally between the diencephalon ventrally and the hippocampian body of the fornix dorsally at the level of the interventricular foramen. The columns of the fornix that course caudal to the rostral commissure form the rostral border of this foramen on each side. The caudal border of this foramen is the portion of choroid plexus that is continuous from the third ventricle to the lateral ventricle. Here, the rostral extent of the leptomeninges between the diencephalon and telencephalon is associated with this choroid plexus. The cingulate gyrus consists of cerebral cortex and its corona radiata, the cingulum. It is located dorsal to the corpus callosum and is continuous caudally with the parahippocampal gyrus and rostrally with the septal area. The cingulum is a long association tract consisting of longitudinal axons in the white matter, corona radiata, of the cingulate gyrus. See figure 17-2 and plates 3-7 in chapter 2. These axons course from the parahippocampal gyrus, located caudally, to the septal area and frontal lobe gyri located rostrally. The septal area consists of the subcallosal area, which is the cerebral cortex ventral to the genu of the corpus callosum and the septal nuclei. The septal nuclei are a collection of neuronal cell bodies in the rostral septum pellucidum that bulges into the medial side of the lateral ventricle. This is dorsal and just rostral to the bend in the body of the fornix, where it forms the columns of the fornix. The septal area connects with the hippocampus by way of the adjacent columns of the fornix, with the amygdaloid body through the diagonal band and stria terminalis, and with the habenula nucleus via the stria habenularis thalamus. See plates 3, 6 in Chapter 2. The medial forebrain bundle courses quadrantally from the septal area into the hypothalamus. By way of this pathway, limbic system efferents may influence the hypothalamic centers that control the activity of the general visceral efferent (GVE) system. The function of the limbic system involves visceral motor activation. Hypothalamic nuclei serve in the upper motor neuron system that regulates the GVE system. These hypothalamic nuclei receive numerous limbic system efferents. Diencephalon and the diencephalon, the epithalamic habenula nucleus and the rostrothalamic nucleus function mainly in the limbic system. See figure 17-2. The habenula nucleus is part of the epithalamus, located on the dorsicaudal median region of the diencephalon, adjacent to the third ventricle and rostral to the pineal body. See plate 6 in Chapter 2. It connects with the telencephalic septal area by way of the striatum habenularis thalamus, which is a column of axons located adjacent to the dorsal component of the third ventricle. The choroid plexus of the third ventricle attaches to the stria on both sides. The habenula nucleus connects with the intercrural nucleus of the mesencephalon via the habenulo-intercrural tract. A short habenula commissure connects the two adjacent habenula nuclei. The rostrothalamic nucleus receives afferents from the mammillary body of the hypothalamus through the mammillothalamic tract. See figure 17-2 and plates 5 and 6 in Chapter 2. The rostrothalamic nucleus projects predominantly to the cingulate gyrus and adjacent neopallium. The limbic system component of the hypothalamus is the mammillary body. The paired mammillary bodies are located adjacent to the ventral midline and the most caudal part of the hypothalamus. They protrude from the ventral surface of the hypothalamus just caudal to the infundibulum of the hypothalamus. See figure 17-2 and 2-10, and plates 5 and 6 in Chapter 2. They connect with the hippocampus by way of the columns of the fornix and with the rostrothalamic nucleus via the mammillothalamic tract. The paired columns of the fornix and mammillothalamic tracts pass through the hypothalamus adjacent to the ventral portion of the third ventricle. In addition to these pathways, the mammillary bodies connect with the mesencephalic tegmentum and the visceral motor nuclei in the medulla through the mammillategmental tract. The mammillary peduncle connects caudally with the mesencephalic intercrural nucleus. See figure 17-2. Mesencephalon. The intercrural nucleus is the only limbic system nucleus in the mesencephalon. It is located ventrally, adjacent to the intercrural fossa and between the two cross cerebri on the ventral surface of the mesencephalon. See plates 8 and 9 in Chapter 2. It connects with the habenula nucleus by way of the habenulo-intercrural tract, with the mammillary bodies via the mammillary peduncle, and with a reticular formation in the brainstem, which, in turn, influences the visceral motor nuclei. The general visceral efferent lower motor neuron in the medulla. Function. The limbic system receives and associates impulses from the olfactory, special visceral afferent, optic, special somatic afferent, auditory, special somatic afferent, exteroceptive, general somatic afferent, and interoceptive, general visceral afferent, sensory systems. It projects predominantly to the hypothalamus and caudal brainstem, influencing primarily the visceral motor neurons. The limbic system is involved mostly in emotional and behavioral patterns. Emotion involves visceral reaction, which is controlled largely by the autonomic nervous system. This system is regulated centrally by the hypothalamus, which accounts for the multitude of connections between the limbic system and the hypothalamus. The limbic system is considered to function in humans as the higher center controlling the psychic and motor aspects of behavior. It is the portion of the brain involved in basic human drives, sexual activity, emotional experiences, memories, fears, and pleasures. Dr. James Papez, professor of neurology at Cornell University, suggested, in 1937, that the part of the renencephalon now classified as the limbic system was concerned with activity other than the perception of smell. Following his observations of the distribution of the rabies lesions in these renencephalic structures in dogs and the bizarre behavior exhibited by rabid animals, he attributed to these structures a role in the control of normal behavior. Since then, many different experimental procedures and clinical observations have substantiated this role of the limbic system in the control of an animal's behavior. These observations have included the effect of direct stimulation of renencephalic structures, the effect of ablation of portions of these structures, and the clinical syndromes produced by diseases causing lesions in these structures. The specific results have varied, even with the use of similar procedures, because of the difficulty in the exact placement of stimulating electrodes and the variable spread of excitation to adjacent structures, coupled with the fact that adjacent nuclei may have diametrically opposed functions. Surgical ablations that were repeated often lacked specificity. Nevertheless, the general conclusion drawn from all of these observations is that the alteration of the animal's behavior suggests that a basic drive has been satisfied or that the condition of an unsatisfied basic drive has been created. Some examples of these observations follow. Self-stimulation. Self-stimulation experiments were designed in which electrodes were implanted in various specific areas of the limbic system, and stimulation occurred when the experimental animal stepped on a lever or bar in the floor of its cage. The response observed was presumed to be pleasurable when it was sought and continually repeated by the animal, to the exclusion of feeding. A painful experience was assumed to have occurred when the stimulation was actively avoided. Such self-stimulation of the intercrural nucleus, septal area, and rostral hypothalamus in cats and rats was sought so actively that the animals continually pressed the bar and did not eat. These areas have been called pleasure centers. Similar stimulation of the lateral hypothalamus and selected mesencephalic areas resulted in complete avoidance of the source of the stimulus. These areas were referred to as pain centers. Direct stimulation of the feline cingulate gyrus, amygdaloid body, or hippocampus results in the production of a focal seizure, often referred to as a psychomotor seizure. This form of seizure is characterized by marked abnormal behavior that often progresses into a generalized seizure with recumbency in tonic-clonic somatic motor activity of the limbs, expression of arousal, fear or rage, or both are observed. Direct stimulation of the temporal lobe in humans under local anesthesia has caused individuals to completely recall a past experience and express the full emotional impact of that event. Upon cessation of the stimulus, the person does not remember recalling the event. Experimental destruction ablation experiments have resulted in variable responses, all of which show an alteration in the animal's behavior. In cats, amygdalectomy results in unfriendliness and fear or even a rage response. The latter involves a complete sympathetic response, with a tendency to attack animate and inanimate objects. Hypersexuality in males and hyperphagia also have been observed. All of these behaviors represent unsatisfied basic drives that the animal is attempting to remedy. Amygdalectomy has caused aggressive monkeys to be tame, non-aggressive, and sometimes hypersexual and to show no emotional response when confronted by objects or events that formerly elicited an emotional response. Lesions in the temporal lobe in humans often cause psychomotor seizures. Removal of the temporal lobe may stop the seizures but seriously blunts the emotional responses of the individual, and the memory of past events is often lost. As a form of therapy, bilateral lesions have been produced in the amygdaloid body in dogs that showed variable degrees of aggression and viciousness. This procedure has seemed to be helpful only in alleviating the aggressive behavior in nervous, fearful biting dogs. Destruction of the amygdaloid body or hippocampus in cats, by applying aluminum oxide cream directly to the area, resulted in psychomotor seizures. Diseases that cause lesions in the temporal lobe in humans often are the source of psychomotor seizures. Neonatal or childhood trauma and infectious diseases that cause encephalitis of this area, such as the measles virus, may cause damage to the temporal lobe. The temporal lobe is closely associated with the amygdaloid body and hippocampus. Their functions overlap, and the lesions described as occurring in the temporal lobe usually involve the hippocampus as well. Psychomotor seizures in humans are characterized by loss of contact with the external environment, by hallucinations of visual events, or by visceral sensations, tastes and smells, that are pleasing or distasteful. They are accompanied by visceral motor activity such as pupillary dilation, salivation, mastication, and fecal and urinary excretions, and by somatic motor activity consisting of wildly running around, as though searching for something, along with an excessive expression of emotion. They usually culminate in a generalized seizure characterized by falling on one side, opisthotonous, and tonic, rigid extension, and clonic, rapidly alternating contraction and relaxation of a muscle, activity of the limbs, alternating with paddling or running movements of the limbs. Complete recovery follows. The duration may range from 1 to 3 or from 10 to 15 minutes. Focal seizures with a component of abnormal behavior, psychomotor seizures, have been observed in dogs that have lesions in the piriform lobe or hippocampus. When agonized flour was used in dog foods, it caused necrosis in these areas bilaterally and produced this kind of seizure. Similar necrosis resulting from ischemia of unknown origin, seizure-induced excitotoxic degeneration, and inflammations caused occasionally by the canine distemper virus produce the same abnormal behavior. In dogs, a focal seizure referred to as a running fit is an event where the affected dog may initially have a period of uncontrolled, wild running around in its environment, combined with barking and growling and complete lack of awareness of anyone or anything in its environment before falling on its side, and exhibits tonic-clonic motor activity of its limbs and opisthotonous, typical of a generalized seizure. Occasionally, the psychic stage of the seizure is manifested in what might be called a hallucination. The dog may stand in a corner, barking and growling, with dilated pupils and erect hair along its back as if it were going to attack an object, although nothing is there. Extreme fear may be manifested. This dog is usually unresponsive to the owner during these episodes. A common cause in dogs of seizures that are accompanied by psychic stages with bizarre and abnormal behavior is lead poisoning. There have been no adequate studies of the distribution of the lesions to determine whether the limbic system structures are more seriously affected in these dogs. Frontal lobotomy. Frontal lobe structures are closely connected with the limbic system and hypothalamus and are involved in the status of an animal's behavior. Frontal lobotomies have been performed in humans and in animals to alleviate violent, aggressive behaviors that are destructive in nature. In lobotomized humans, extensive changes in personality and loss of intellect accompany the alleviation of the aggressive behavior, so the procedure is infrequently used. The results in dogs have been variable. In one study, frontal lobotomies were performed on 2 groups of aggressive animals. One group consisted of male mutes used as sled dogs that had marked aggression toward each other. The other group of dogs and cats consisted of house pets that had histories of aggressive behavior toward humans. The lobotomies performed on the malamutes with interspecies aggression were more successful than those performed on the animals aggressive toward humans. In most instances, the lobotomized malamutes were able to return to the sled dog team and to function without attacking the other dogs on the team. However, this surgical procedure is not without serious sequelae and should be performed only as a last resort. Electroconvulsive shock therapy has been used alone or together with lobotomies on dogs with aggressive behavior. In our clinical experience, we have removed numerous naturally occurring neoplasms associated with the olfactory bulb, olfactory peduncles, and frontal lobe of the cerebral hemispheres up to the level of the cruciate sulcus unilater. A lie without ill effect in both dogs and cats using a modified transfrontal craniotomy approach. The owners of the animals report no change in behavior associated with unilateral resection of these regions of the brain, and the patients are remarkably normal soon after recovering from surgery. The brain in this area is resected in an attempt to remove as much of the neoplasm as possible. Behavioral abnormalities. Behavioral abnormalities are common in domestic animals. The abnormalities may be defined as changes in an animal's normal habits, personality, attitude, and reaction to its environment and in its general sensorium. Some of the clinical signs that make up this abnormal behavior include depression, dullness, lethargy, obtundiscion, and stupor, semi-coma, dementia, failure to recognize owners, familiar environments, and objects, and the inability to learn are referred to collectively as cognitive disorders. Other clinical signs include destructive behaviors, propulsive pacing or circling, hypersexuality, polydipsia, polyphagia, pica, and anorexia. Normal behavior requires a complex integrated involvement of the entire nervous system but predominantly the prosencephalon. Some of these behavioral abnormalities are caused by structural lesions in the prosencephalon, for example, neoplasia, ischemia, inflammation, or inherited degeneration that involves some component of the limbic system. Some abnormal behaviors are psychological disturbances in which no recognized structural or metabolic disturbances of brain function are present. Some of them may be explained as abnormalities in neurotransmitter levels or interactions. Other abnormal behaviors represent inappropriate behavior for the environment in which the animal is expected to live. The latter include aggression or destruction, which are normal animal behaviors but may be inappropriate in its environment, where it is inconvenient or dangerous to the owner or others in that environment. Almost any disturbance of the prosencephalon will cause one or more of these clinical signs that are considered to be abnormal behavior. A few behavioral signs are more specifically related to an anatomic site, such as polydipsia with pituitary hypothalamic neoplasia, encephalitis, neoplasia, intoxications, malformations, injuries, ischemia and infarction, and metabolic disorders must be considered in the differential diagnosis of a prosencephalic disorder that causes abnormal behavior. A structural brain lesion is supported as the cause if neurologic deficits other than the abnormal behavior are determined during the neurologic examination, especially if the deficits are asymmetric. If the neurologic examination is normal and ancillary blood and urine studies do not support a metabolic disorder, a psychological disturbance or inappropriate behavior must be considered. For these latter disorders, all ancillary procedures such as blood chemistry, evaluation of the cerebrospinal fluid, and advanced imaging, computed tomography, CT, and magnetic resonance imaging, MRI, will be normal. The evaluation of animals for the cause of their psychological disturbance or inappropriate behavior requires detailed analysis of their environments, training, and all their experiences since birth. Frequently, environmental alterations or the lack of training or inappropriate training are identified and, with correction, the problem may be rectified. Obviously, this requires extensive cooperation on the part of the owners. Numerous publications have dealt with the recognition, diagnosis, and control of these kinds of behavioral abnormalities. Animal behavior is now recognized as a specialty in veterinary medicine, and these specialists should be consulted in some of the complex clinical situations. English Springer Spaniel Rage Syndrome, an episodic behavioral abnormality, has been recognized in the English Springer Spaniel. This disorder occurs in dogs that are normally well-behaved, well-adapted house pets. It consists of an episodic sudden change in behavior that lasts a few seconds to a few minutes, with the dog returning to normal immediately after the episode. The first clinical signs may be a sudden snapping into marked bilateral mydriasis, with a glazed appearance to the eyes. This often follows a mild provocation such as being approached or attempts to pet the animal. A few fine tremors may occur in the pelvic limbs. The dog will often wag its tail, growl, and attack and bite animate or occasionally inanimate objects. This aggression is often directed at just one member of the family with whom it lives. During the episode, the affected dog is completely unresponsive to its normal environment, including the owner. At times, the dog may crouch under a table or desk and not allow anyone near it. Be acutely aware that these dogs are not predictable, so appropriate action must be considered, especially in families with children. The episodes may occur sporadically, weeks apart at first, but often increase in frequency to many times a day. In the majority of dogs, the clinical signs begin at around 18 months of age, but the range of onset varies from about 3 months to 4 years. The disorder occurs predominantly in males. In these dogs, all ancillary studies are normal. In the few dogs in which MR images have been obtained, no abnormalities have been observed. Electroencephalography has not been found to show evidence of a consistently abnormal tracing. The use of high levels of progestins and vigorous training programs may help to control the disease, but neither will completely eliminate all aggressive behavior. No light microscopic lesions have been found in autopsy studies of euthanized dogs. This disorder resembles a focal seizure that involves the limbic system in that it is an episodic disturbance of brain function that resolves spontaneously and recurs at varying intervals. However, it is completely unresponsive to anticonvulsant therapy. The lack of any electroencephalographic abnormality and the lack of response to anticonvulsant therapy suggest that this is a behavioral disorder. It is hoped that neurochemical studies will reveal the basis for this behavioral disorder and that genetic studies will define the presumed inherited basis. An inherited idiopathic epilepsy has also been diagnosed in this breed and should not be confused with this behavioral disorder.